Non-small cell lung cancer. Non-small cell lung cancer, NSCLC, is the most common type of lung cancer, accounting for approximately 85% of all lung cancer cases. It is named non-small cell because the cancer cells are larger than those in small cell lung cancer. NSCLC comprises several subtypes, each with distinct characteristics and treatment approaches. Adenocarcinoma. This subtype is the most common form of NSCLC and often develops in the outer regions of the lungs. It is more common in non-smokers and tends to grow more slowly than other types. Squamous cell carcinoma. This type usually develops in the lining of the bronchial tubes and is often linked to a history of smoking. It tends to grow more centrally in the lungs. Large cell carcinoma. This is a less common subtype and tends to grow and spread quickly. It can appear in any part of the lung. Other rare subtypes. There are other rare subtypes of NSCLC, including adenosquamous carcinoma and sarcomatoid carcinoma. Causes and risk factors. The primary cause of NSCLC is cigarette smoking. Other risk factors include exposure to secondhand smoke, exposure to certain environmental toxins, such as asbestos and radon, and a family history of lung cancer. While NSCLC is strongly associated with smoking, it can also occur in non-smokers. Symptoms. Symptoms of NSCLC are similar to other types of lung cancer and may include 1. Persistent cough. 2. Chest pain. 3. Shortness of breath. 4. Unexplained weight loss. 5. Fatigue. 6. Coughing up blood. 7. Hoarseness. Diagnosis. Diagnosing NSCLC involves a combination of imaging tests, such as CT scans and PET scans, biopsies, and sometimes molecular testing to identify specific genetic mutations that can guide treatment decisions. Staging. NSCLC is staged based on the size of the tumor, whether it has spread to nearby lymph nodes, and whether it has spread to other organs. Treatment. Treatment for NSCLC depends on the stage of the cancer, the specific subtype, and the overall health of the patient. Surgery. Removal of the tumor and, in some cases, surrounding tissue and lymph nodes. It is most effective for early-stage NSCLC. Radiation therapy, using high-energy rays to target and kill cancer cells. It may be used alone or in combination with surgery or chemotherapy. Chemotherapy, administering drugs that kill rapidly dividing cells, including cancer cells. It can be used before or after surgery or as the primary treatment for advanced stage NSCLC. Targeted therapies, drugs that specifically target certain molecules involved in the growth and survival of cancer cells. They are often used for certain subtypes of NSCLC with specific genetic mutations. Immunotherapy, boosting the body's immune system to fight cancer. Immunotherapy has shown promising results, especially in advanced NSCLC. Prognosis. The prognosis for NSCLC varies widely depending on the stage at diagnosis, the specific subtype, the overall health of the patient, and how well the cancer responds to treatment. Early detection and advances in treatment have improved survival rates, especially for those with localized disease. However, the overall 5-year survival rate for NSCLC remains variable, with more favorable outcomes for early-stage cases. Survival rate. Survival rates for non-small cell lung cancer, NSCLC, can vary widely and are influenced by several factors, including the stage at which the cancer is diagnosed, the specific subtype of NSCLC, the overall health of the patient, and how well the cancer responds to treatment. Survival rates are typically reported in terms of the percentage of people who are alive a certain number of years after diagnosis. It's important to note that survival rates are statistical estimates and may not predict an individual's outcome. Advances in treatment and personalized medicine are continually improving the prognosis for many individuals with NSCLC. Localized stage, Stage 1. The 5-year survival rate for individuals with localized NSCLC is relatively high, often ranging from 60% to 80% or higher. Regional stage, Stage 2 and 3. Survival rates for regional NSCLC, where the cancer has spread to nearby lymph nodes or structures, are generally lower than for localized disease. The 5-year survival rate may range from 30% to 60%, depending on the extent of regional spread. Distant stage, stage 4, NSCLC that has metastasized to distant organs or structures typically has a lower 5-year survival rate, often ranging from 10% to 30%. It's crucial to interpret these statistics cautiously. The survival rates provided are general estimates and can't predict the outcome for any individual case. Additionally, early detection through screening programs and advancements in personalized medicine are contributing to more favorable prognoses for certain individuals with NSCLC. Thank you for watching the video till end.
The information provided here is for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or heard in this content. If you think you may have a medical emergency, call your doctor or emergency services immediately.